Bellafill is a unique collagen-based dermal filler with microspheres that can instantly smooth facial wrinkles known as nasolabial folds or smile lines for beautiful, natural-looking results that last. This video demonstrates the proper patient protocol and injection techniques for the treatment of nasolabial folds, known as smile lines. The primary objectives are to describe Bellafill's composition and proposed mechanism of action, to review a typical patient consultation and skin test, to demonstrate the Bellafill injection technique, and to demonstrate follow-up injections with Bellafill. Skin is made up of 3 layers: the epidermis, dermis, and subcutaneous tissue. Over time, the number of epidermal cells decrease, become thinner, and divide more slowly. The dermal layer thins and less collagen is produced. Fat cells in the subcutaneous layer that make the skin look plump and full also shrink with age. These changes can cause the skin to wrinkle and sag. Bellafill is a smooth collagen gel-based dermal filler that immediately adds volume to the skin to lift and smooth out the wrinkle or fold to the level of the surrounding skin. Bellafill is comprised of 80% purified bovine collagen gel with 20% polymethyl methacrylate (PMMA) microspheres. It also contains the anesthetic lidocaine for maximum patient comfort. During an in-office treatment, Bellafill is injected beneath the wrinkle. Following the injection, the collagen gel in Bellafill provides immediate volume and lift. Over time, the collagen is absorbed by the body. The PMMA microspheres remain in place and form a matrix that provides lasting support skin needs for wrinkle correction for smoother-looking skin. More than one treatment may be necessary to achieve full correction. Correction is immediate, and patients are able to return to normal daily activities right away. Bellafill has been proven to work with all skin types on adult men and women of all ages. In clinical studies, Bellafill was proven to be statistically significantly superior to the control treatment at 6 months. Unblinded evaluation out to 12 months confirmed a consistent level of effectiveness. Additionally, there were no significant differences in side effect rates between Bellafill and the control treatment. Look younger, longer with Bellafill. Immediate correction, natural look, lasting improvement. Youthful looks that last. During the initial patient visit, discuss the procedure, risks, and benefits, and explain how Bellafill works. Review with the patient the degree of nasolabial fold correction that can be achieved, post-injection expectations, and the anticipated cost. Explain that it may take a series of injections to achieve optimal correction. It is recommended that an informed consent document also be signed prior to treatment. A Bellafill skin test must be administered 4 weeks prior to the Bellafill treatment to screen for pre-existing allergies to bovine collagen and lidocaine. Each Bellafill skin test kit contains either 2 or 5 pre-filled syringes and 26-gauge 5/8-inch needles. The skin test is administered intradermally into the volar aspect of the forearm. Inject no more than 0.1 cc of Bellafill skin test. The skin test syringe is overfilled, so ensure the correct amount is injected. The Bellafill skin test results card will assist the patient in monitoring the skin test result over the next 4 weeks. Patients should be instructed on monitoring the injection site for positive response and be given the card to fill out at home. A positive response is defined as erythema, induration, tenderness, swelling. If any of these lasts more than 24 hours after injection or appears more than 24 hours after injection, it is considered a positive response. An equivocal response is one in which there are no local signs of skin reaction, but there are systemic symptoms such as arthralgias or myalgias. Patients demonstrating a positive or two equivocal responses must not be treated with Bellafill. Lastly, schedule the patient for the second visit at least 4 weeks later. Once the patient has a confirmed negative skin test, he or she is ready to receive Bellafill injections. Take before treatment photos. Taking good photos is critical to demonstrating results and helping your patients understand the benefits of treatment. Provide the patient with a hand mirror so he or she may follow along while the treatment progresses and compare the treated and untreated sides. Each Bellafill kit contains either 2 or 5 pre-filled syringes and 26-gauge 5/8-inch needles. The Bellafill syringe should be brought to room temperature before injection. You may inject Bellafill with the 26-gauge needle that is provided. To assemble, remove the tip cap from the hub. Then tightly secure the needle to the syringe by twisting it. The hub should be fully seated in the syringe. Pull off the guard and express a tiny drop of Bellafill to ensure the needle is not clogged. As with any dermal filler, proper injection technique is essential for optimal treatment results. Palpate the area to determine if there are any pre-existing lumps or bumps and point these out to the patient. The area to be treated should be aseptically cleaned. The needle is then inserted into the dermal-subdermal junction at a 20 to 40 degree angle. Bellafill is injected in the nasolabial folds using the tunneling or retrograde linear threading technique. Begin injecting at the distal portion of the fold and advance toward the nasal triangle. The outline of the needle should be visible, but the gray of the needle should not be seen. As the needle is withdrawn, apply constant pressure on the syringe plunger to ensure uniform deposition of material. Remember to stop injecting before fully withdrawing the needle. The layers of subdermal strands form a support structure to correct the wrinkle and to prevent further wrinkling. After injection, palpate the injected wrinkle to confirm uniform deposition of Bellafill. Patients should come back for evaluation between 2 weeks and 3 months for a follow-up visit. During the follow-up visit, photograph the patient again using the same photography techniques as directed in the initial visit. Have the patient identify if there are any wrinkles for which he or she would like to receive a second treatment. When performing a touch-up procedure, palpate the original treatment area to determine the location of the first injection. Insert the needle above or below the first injection. Using the tunneling technique, repeat the injection process used in the original treatment session. 1 or 2 successive treatments may be necessary to achieve the desired level of correction. Usually, there is minimal to no downtime. And best of all, Bellafill restores rather than just fills for natural, enduring results. Immediate correction, natural look, lasting improvement. Youthful looks that last. Please refer to the Bellafill instructions for use for complete information on contraindications, warnings, precautions, and adverse events.